Hi, my name is Kenneth Jones, and today I would like to talk about the use and advancement of technology in the healthcare field. So, what do we mean by technology in healthcare? Well, it's more than just the machines that help us perform extensive medical procedures, whether they be surgical, diagnostic, or imaging related, like MRIs, X-rays, and CAT scans. It also is the systems that allow the effective delivery of patient information between multiple systems and providers. Devices that allow monitoring of individual as well as public health conditions, and software that aids in managing healthcare costs. An umbrella term for these technologies is health information technology, which is share and analyze patient health information. And it encompasses telemedicine, electronic health records, and telemonitoring, which is aided through the use of wearable tracking devices. So what is telemedicine? Telemedicine uses advanced telecommunication technology to exchange health information and perform health services across geographic, time, social, and cultural barriers. And this requires the electronic transfer of patient information. This is very useful, especially in areas where we see physician shortages. And there are currently two types in use and being further developed. The first of which is video teleconferencing, which allows for real-time patient consultations at virtually any distance. Case analysis involving different teams of physicians, and comprehensive stroke evaluations, which eliminates the need of providers and patients to be in the same room. It can be done through two-way video and audio conferencing. The second type is store and forward, which refers to the transferring of digital images to different locations at virtually any distance, because this is electronically based information. Some of the applications we see in the field already are teleradiology, which is the digitized X-ray images transmitted to a remote location for review by a radiologist. Telepathology, transfer of image-rich pathology data between distant locations for diagnosis. And telepharmacology, which is the delivery of pharmaceutical care via electronic transfer of patients' prescriptions. And telemedicine can be applied across multiple technology platforms, whether it be smartphones, mobile computers, or even email or social media. These platforms make healthcare mobile. We have the ability to explain clinical results bedside, consult data on the way to or during a procedure. We also are even seeing iPad versions of electronic healthcare records, which is very useful for viewing your patient information on the go. So what is an electronic health record? An electronic health record allows for the viewing of the complete medical history of an individual with just a few clicks. The automatic transmission of medical conditions that must be reported to the government. Some of these conditions could be cancer, malaria, sexually transmitted diseases like gonorrhea and syphilis, are all automatically reported. You also have the ability for automatic reminders for preventative care services. So this aids in management of chronic care conditions, reviewing a patient's data to see if they need to be reevaluated for their immunizations or vaccinations. We also have the ability for clinical decision support within electronic health records. This is a built-in database of medical literature and information that allows a physician to make evidence-based decisions rather than just guessing on what he believes the right treatment or prescription may be, and has it right at his fingertips as he's entering data in the electronic healthcare record. Also aids in the elimination of medical errors in terms of prescribing the wrong medication to a patient, or prescribing the wrong dose of that prescription to a patient. Also aids in the prevention of duplication of services, which heavily increase the price of healthcare. An emerging feature of the electronic health record that providers are trying to implement is the personal health record, and this allows for more patient involvement in what is put into their record, and has the ability to allow providers to provide more individualized, patient-centered care. Telemonitoring and wearable tracking devices. These allow for the monitoring of health conditions using mobile sensors and devices, and then the transmission of the information gathered to a provider wirelessly. An application of this is monitoring vital signs that automatically relay health information to the provider. This can be done through the use of smartphones and tablets in clinical settings, which is becoming more and more common and necessary as we, as a society, advance technologically. And this involves like apps that allow monitoring of fitness and chronic conditions. Allows for a real-time automatic transfer of numerical data into charts and graphs that are much easier for the patient to understand and comprehend. And just the fact that 56% of Americans now have access to the internet by way of smartphone is an indication that we are moving towards a more mobile society, and healthcare needs to follow in those footsteps. We also have a greater ability for patient self-monitoring. Things like body weight, food intake, and physical activity are all made trackable by devices, technology like Fitbits, Apple Watches. And some of the functionality of these devices, they would include heart and pulse rate, breathing rate, blood pressure, and even blood glucose, as well as sleep. So there are quite a few benefits to implementing health information technology throughout the field, but there are also concerns, and one major one being the cost. Who is going to pay for these systems to be installed and implemented in a clinical setting? Right now, providers are the ones expected to be bearing these costs instead of insurers or the government or even patients. Current reimbursement methods may reimburse face-to-face interactions more than they would through the use of telemedicine or telemonitoring. We also have a problem with patient confidentiality, keeping patients' records safe and secure from prying eyes or even from professionals that should not have access or should not be looking at their patient profile if they're not related to their case. Physical spaces also needed to store these large amounts of data and equipment. Aside from just the space on your computer or smartphone, infrastructure needs to be built to allow these processes to happen on a global scale. Let's see. Cross-state licensure professionals. Legally speaking, there in 21 states across the United States, physicians can only practice on patients who reside in their state. This is a barrier for implementing health information technology, because the whole point is to be able to provide care at any distance. If physicians aren't able to provide that care at any distance, if they're restricted to only practicing in their state, calls into question how viable health information technology is in the field. Another barrier to health information technology implementation would be poor system usability. There's no standard interface currently, which is a big problem in making sure that systems can communicate with each other, there also are user limitations. So depending on how complex a system is, how long you give employees to learn to use that information, if they choose to use the information correctly. These are all limitations that that users have, that we must figure out before we can implement this on a standard nationwide or even globally. There also is an issue with the requirement of an internet connection to transfer this data. In the event that the power grid shuts down, or you don't have internet access to look at a patient's data, how can you make a clinical decision if paper is being eliminated? And the answer is you can't. So finding a way to get around having to have an internet connection is key to making sure that we can implement this to make it standard. And again, there's also a lack of generalizable information regarding what will actually improve healthcare and drive down the cost, because it costs to implement, it costs to train employees, but at the same token, we still want to improve care, which this definitely will. Health information technology definitely has the potential to do. So I want to leave two questions with you. The first of which is, if information technologies have the potential to reduce a patient's needs of care, which would reduce the hospital's revenue, and the health information systems themselves cost providers to implement. How can facilities find a way to protect the bottom line of turning a profit? This was a common theme throughout some of the articles that I used during my research that were not able to answer, which is key because hospitals definitely have to protect the bottom line of turning a profit to stay afloat. If you were implementing a system that essentially allows patients to avoid coming to receive services, then generally your revenue is depleted. And also, how can we restrict data enough to protect patient confidentiality while still allowing access to the patient and necessary provider, which is another commonly posed question throughout my research. And people don't have an answer yet, but that will definitely need to be answered before we can implement this on a nationwide or global scale. I also have included in the slides a Word document containing some of the information that these sources that I was able to use, and this is my presentation on technology in the healthcare field.